Hey Dan, how are you?
Hey Michelle, I'm good. Always exciting to be back and record podcasts, and we're doing new things in 2025, so I love it.
Yeah, we're just kind of just enjoying the new technology and being
Mhm.
in video. You know, really when you look back at the last couple years, very rarely do we record remotely, and this is like our second remote recording in 2025.
It is. I know. Like, look at us. We're trying out new things. So, and new technology, which I think is what's behind this. And as you were saying with our last episode, these will be kind of like
The early episodes.
and
So
right.
guys, we applied through an online platform for our first podcasting event, and we got accepted for, coverage of the cost of the event through our
Sure.
Buzzsprout service. And it's kind of fun because now we're gonna learn what like people who do podcasting for their regular lives do.
Right. Like, yeah. It was funny because they asked us like how many downloads we get. We're like, do we
But they
just
use they use different words, so we just have
right,
to figure out what those words are in the lingo. So
right.
we're still newbies, even though we're in our fifth season.
Exactly. Like that, right. Like we are, I think that's going to be like the fascinating thing is we're going to go to this event and we're going to be like, I don't know anything about what you people are talking about. Like,
Right. Well, someone asked us the other day they wanted to see the recording studio since we had put up the psychedelic, the backdrop, and when I moved the
uh,
recording studio to the back, that's down now. It may be up again, but
mhm.
I do think we owe the people, some view of the recording studio for our in-person event. So we have January 10th, which will or have already passed by the time that you're listening to this episode because we're recording the week before. Um, but our March 9th event will be an in-person event, and, I do think that we'll have our event to get especially the ladies, maybe everybody because it's International Women's Day,
Mhm.
a different, our getting to sleep pack that we have. I've been accumulating things. Have you been accumulating anything for our
For giveaways.
bags?
Yeah.
Yeah. I've been
Yep.
accumulating things. I'm excited about it.
I haven't found, I would say there's two things that I've picked up that I'm like, I don't know. I feel like I'm still working on it. So the answer is no. But I mean, I feel like, but this is my idea of like swag in general is that it has to legitimately be helpful. Like nobody wants a pen
Right.
or like post-it notes. Like nobody needs those things, you know.
What
Yeah.
I think I've focused a lot more on is, using different senses because, like we've talked about before, you and I have different senses that kinda speak to us, particularly for
Right.
winding down. So I
Hmm.
focused on some of those things. And, anything, even like little notebooks and like the smelly markers and things like that, they can be very helpful for this time.
Yeah, absolutely. Lots of different sensory kind of aspects, sight, touch, smell, all of it. Like there's so many different ways to kind of communicate to your body when it's like, okay, calm down, like redirect that energy. So,
Yeah. So one of the things that I've been doing since it got colder is drinking more of my Ryze cocoa at night, and that
oh,
kinda got me into do you wanna push people to ingest things at night? Particularly in January, we're focusing on, like, a lot on health, and
mm,
actually what this episode today is gonna be about is about the I don't wanna call it a craze, but it kind of is another fad type of craze about using medication specifically for weight loss, and they've been approved for other things. They've
yep,
been approved for,
we're going to talk about.
diabetes and now obstructive sleep apnea, but,
Mm,
some of these mushroom drinks are touted to also improve people's metabolism. So, on a previous episode, we talked about the coffee and the chai version,
mhm,
that have some natural caffeine in it. The one for at night, the cocoa, the sleep one is very pleasant, particularly when you're looking for kind of a beverage to kind of warm you up.
mhm,
I enjoy the taste of it, so I'm not enjoying the fact that you have to get up more to pee at night because you're taking in the liquid. But it is a very nice, relaxing thing to take, at night.
right.
It may go into this basket, because again, maybe some ingesting of something that's natural could be in there. Don't know.
Hmm. I love it. I think it's worth kind of exploring. So yeah,
But little nighttime snacks, that's
absolutely.
not
They're
something I
all,
wanna encourage, but if it's working for somebody, that is something that would work for a person.
and it definitely could. I think that the key caveat with all of these things is that you have to pay attention to your body's response and reaction to things. So, I have some clients that really don't like, nighttime teas or, the herbal teas. It's not even about the caffeine. It's just about maybe consuming, fluid before bedtime because then they feel like they're waking up more often to use the restroom.
Right,
And so I would say you just have to pay attention to you and to your body. Um, which is why learning, one of the key skills that you're learning when we're gonna do the whole, like, CBTI kind of like, episode by episode, like, session by session kind of breakdown coming up in this year, is that you really have to begin to say, "Okay, this is what we know about certain things, and what is gonna be applicable to me and to my body and to my experience." Um,
right.
so 'Cause we each get activated and deactivated by different things in different ways. So,
Yeah, and at different times of our lives too. So what maybe worked for you previously may not always work for you now. So
mhm,
you have to kind of constantly be aware of it.
yeah.
So let's like kind of dive right into the class of medications. They're typically called the GLP or SGLT1, sorry, SGLT2 inhibitors.
Mhm,
SGLT1, the SGLT2 are the things kind of like metformin, but the whole idea is this class of medicines was approved for type 2 diabetes maybe about 6, 7 years ago.
mhm,
And then they've looked at other avenues to expand their use because they've been very successful in helping people not just control blood sugars, but also keep weight down. And in people that are very overweight to really help significantly with weight loss.
mhm,
About 2 years ago, down in San Diego, they decided to undertake this study with obstructive sleep apnea. So that's where it kind of started overlapping with specific sleep patients. And they claim in this trial that was again sponsored by the drug itself, the Tirzepatide, which is a brand name of Zepbound,
mhm. So
that
Lilly, so that's different than Novo
correct.
and the original GLP-1, the Ozempic, the Wegovy, um, yeah.
They decided to say that the specific where the weight loss is happening is in the upper airway, the tongue, and the neck.
Mhm.
So I know that you did a piece on the news the other, I don't know, a couple months ago now, I guess.
Yeah, I did, and
So
it's
tell me what you talked about in terms of how it affects sleep and this upcoming information that did get pushed out in December.
mhm.
Um, and now it's just this constant people asking, okay, is this the new treatment for sleep apnea?
Yeah, and I would say, the real challenge with these medications, is that there's so much coming out on these GLP-1s, and tirzepatide's a GLP-1 and GIP, so, it has 2 mechanisms kind of, at least that we know of, mechanisms of action, and so when I was on the news recently, I was actually talking about the psychological or the mental health effects that are also kind of being discovered with these medications, and the real challenge is number 1, the research is still new. So it's coming out. There's new stuff coming out roughly like every 6 months on this stuff, and it will probably be that way for the foreseeable future for a while. Um, but what we're really kind of seeing is that with what often shows up with significant weight loss, with these medications, and we initially thought these medications were really kind of gut-based kind of medications, but really what we're discovering is that they're far more brain-based medications.
Mhm.
Um,
Now
and
that people can see us on video, I decided to point.
I love it, right. And so, this is why also too, at least from a mental health perspective, there's definitely these drugs are associated with declines in depression symptoms, also really compulsive types of behaviors, so things that kinda get really easily reinforced. Um, like, like addictive types of things are noticing specifically with alcohol, but also with some other really repetitive behaviors that they're going down when someone is on one of these GLP-1 medications. The actual mechanism of action, the honest answer is we don't fully know. We do know that the hunger, the hunger drive that decreases a lot with these medications tends to be associated with other types of compulsive behaviors. So that part kind of theoretically kind of makes sense, but to be honest, we're still not entirely sure. Um, but that being said, the new findings around sleep apnea are a little bit different in terms of specifically where the weight loss is happening and why that's relevant from a breathing perspective. So,
Yeah, I mean, normally the in your body you release the hormones naturally, and what the medicines are doing is try to accentuate that, maybe for people that their body isn't releasing it like it should, or where it's not going to the right direction when it is being released. So these GIP and the GLP-1 are released by the gut, and they generally increase people's insulin release, and that suppresses appetite, and it slows the stomach from emptying. And when the stomach is more full, it suppresses your appetite. So they feed back into each other, which is really helpful. One of, not anything to do with GLP-1 medicines, they were using low dose naltrexone to also affect people's cravings.
mm,
And it helps in terms of, sleep and breathing on that side too. And again, we don't exactly know the mechanisms of it.
mhm.
Why I think that it's kind of interesting that we decide to go ahead and FDA approve this for sleep apnea is that we're again taking the ownership away from us as individuals that we can solve this problem. And it's really sad to me that they decided to go ahead and do this. Not because we don't need more treatments for weight loss. We do. But I can tell you the biggest risk for sleep apnea in women has nothing to do with your weight or your size. It has to do with hormone balance, particularly the progesterone type of hormone balance. And so if we say that, sleep problems are because of menopause or sleep problems are because of, a misbalance of chemicals or your sleep apnea is just because of your weight, we're really doing a disservice to the fact that we can control this a lot more than we are being told that we can control it. And just like you guys that are listening to our podcast, you want to learn how to sleep better without medicine and without extra things to put on there. Not that these things can't help you, they can, but that we are ignoring the potential real dangers of the medicine.
Mhm. And what
So
are the dangers of these GLP-1s, GIPs? Like, what should someone be aware of?
there's quite a few. I focus on 3. 3 because, being on the medical side, I just worry about things that can kill you. So, it does slow your gut down. So, the number one thing that I tell people about is if you already tend to be more constipated or to have a lot of irritable bowel type of issues, it absolutely accentuates that to the point that some people are like vomiting like they were pregnant, or just having that nauseous feeling all the time. That can lead to real poor eating behaviors. And it can also lead to, if you already had this problem and you say, oh, well, this is just my constipation, I'm just not really going to eat, that'll solve my problem. It doesn't alert you to the fact that your gut could be slowing down to the point that it backs up entirely and blocks off blood supply because of how constipated you get, and you can perforate your bowel. Okay. So, number one scary, scary thing is much higher frequency of bowel perforations and constipation that's going to land you in the emergency room or the hospital. Okay. So, that's number one.
So remember,
Um,
you need to be eating a healthy diet if you're on a GLP-1 and GIP. Like,
Correct. And you should be asked to do this leading up to going on it. It's
mhm,
just the fact that um, you know, people aren't. People are looking at it like this is their magic thing. They can do whatever they
right,
want. They still don't have to be educated.
right,
And if they don't feel hungry, they won't eat. I mean, we know that psychologically that's not true. You can still eat despite not feeling hungry because of the psychologic stuff that you just talked
totally.
about.
You can be bored, you can be sad, you can just be eating from a habit perspective. So yeah, absolutely. But yeah, 100%.
Right. And it doesn't really specifically matter what you're eating to at that point, is the fact that you tend to say, well, I haven't really eaten anything today, so I can eat whatever I want. And then you don't have a lot of nutritional value to it. Okay. So that's the first really scary thing that I see about, and they've taken a couple already off the market. Not the Tirzepatide that was approved for sleep apnea, but some other ones. Okay. So that's number 1. Number 2 is they give you this warning on the commercials and also on the paperwork about if you have this syndrome called MEN2,
Mhm,
those people have a much higher incidence of thyroid cancer.
mhm,
So, a different medicine that's now again off the market was a different type of cancer, which universally tends to kill people. Thyroid cancer, this type does tend to be a pretty serious thing that you have to find out. So they're recommending if you have this disorder that predisposes you in the first place, that you strongly not take it.
mhm.
But it can cause thyroid cancer in other people. It's a medullary type of thyroid cancer, which is of the 3 types of thyroid cancer, the worst.
Mhm.
But again, it can be checked on blood tests and it's usually not fatal. Okay, so that's number 2, and then the third
Like,
one that happens to everybody, okay? Everybody on GLP medicines has a really hard time keeping their muscle. So, you don't just lose fat, you lose muscle, and again, if you lose muscle in your upper airway and your tongue's like one big muscle, you're not gonna necessarily notice it, but as people get older, it's really hard to gain the muscle back, okay? So if you have rapid weight loss in particular and you've lost muscle, you cannot gain it back. And remember, we're not educating people about their diet and their
Mhm,
exercise, and so we're not pushing people to that because we've said it's the wonder drug and you're going to lose a ton of weight and muscle weighs more than fat.
mhm.
Um, so they're really happy with their weight loss results, and we're not focusing on loss of muscle. Now, losing muscle is one of the biggest ways that you can worsen your fall risk, um,
Sure.
with the exception of like narcotics and, muscle relaxants. So we don't want to create unhealthy, thin people. We would like to really work on identifying that this is an issue and that if you're going to be on this type of medicine, you have to combine it with a lifestyle as such that you don't have a ton of muscle loss.
Right.
So
It
those are
rem
my top 3.
well, and, so I love these because I think what's helpful is it really reinforces again, which I mean, you and I have kind of been on the same page about these medications can be an incredibly effective tool for people to use, but you also have to still make some healthy lifestyle changes. You gotta make sure you're eating healthy foods, like, you can't still be eating McDonald's and taking your GLP-1 and thinking that you're gonna get the outcomes that you want. And then you also can't keep taking a GLP-1 and then not being engaging in some type of activity, strength work training, those types of things, because
Right,
your body will drop weight with the medication. Although there's a subclass of non-responders of people, and to be fair, it's not clear why they're non-responders. But that's a whole other piece. But it's one of those things of where if you can do the healthy things, then there can be some real advantages to this. And, I'll be honest, I think for a lot of people, these medications are worth exploring from both like from a sleep apnea perspective, but also even from a cardiovascular risk kind of perspective. At least I know with semaglutide. Um, and I know that it's one of those things of where it's not the simple, like you get your once weekly injection and then, you go about and live your life. Like you do have
right.
to engage in habit change. But if you can do that with these medications, they can be a phenomenal tool. So,
Right. So, at least in my practice, these are medicines that I prescribe with the caveats I just went over.
mhm,
But when you're looking at really aggressively needing to lose weight for a medical problem, or maybe you're needing a surgery that they mandate that you have some significant weight loss prior, and that you feel like you're either doing everything that you can do or you can't do it because of the reason. Like the case in point is, let's say somebody needs a knee surgery,
right.
and they have to lose 30 to 50 pounds prior to having this knee surgery done, but they really can't do the physical activity. They can log their food, but they can't do the physical activity leading up to it. Um, so they're a really good weight loss jump start so
Mhm,
that they can get through that activity. On the flip side, and again, we can go through these flip sides all the time, is there's so many things that you can do not using your knee, for example. from an exercise perspective and still work on strength training and weight loss
Mhm.
in the exercise arena.
Mhm.
So, you shouldn't not do, what you know mentally and physically that you need to do. The medicines just are a helpful assistance, device that are there. And again, if it were you or me, I would totally say if someone's thinking about doing, a weight loss surgery and they're given the choice of whether it's a weight loss surgery or medicines, and they don't have any of the red flags from either standpoint, and the medicine is covered and can be done, and logistically they can't either take time off of work or they have physical responsibilities that make surgery not an option. I think it's a really good choice.
Yeah, absolutely. I mean, I think and again, this stuff's gonna be kinda keep changing, like, the research on this stuff is right now, it's only been, come out for at least for sleep apnea with tirzepatide, um, but and I do know Lilly has another med in the pipeline, the rotrutatide, so it's like a 3rd mechanism of action, so, it's exciting times. We'll see what happens with these medications and what can be helpful, but I think, kind of along the lines that we've talked about in terms of you can't force, good sleep. You have to create the right environment. You can't just like take something and get great health. You have to also create the right, eating habits, the right activity habits, the right sleep habits. That's how you
Right.
get, a better version of you. So,
Well, and, there's a lot of people with sleep apnea that are not morbidly obese, and they're not even
whatever,
over
right.
and not overweight, and we don't want to encourage people that are even marginal on the muscle standpoint or elderly people to take a medicine for losing weight in the upper airway to treat their sleep apnea, which is the proposed mechanism, and potentially have some of these side effects. So, we still need to pay attention to the fact that, from a lifestyle perspective, this is not how humans were meant to live.
Hmm. Sure. Right. Yeah. I mean, which is why healthy lifestyle is still a core part of all of this. Like you have
And
to.
you and I are not gonna ever get paid from, like, drug companies to be spokespersons because at the end of the day, again, when these medicines are either gone, off the shelf, not affordable, we're gonna still get back to the basics and saying, "Listen, you still have to put in the work," whether it's a sleep problem, a weight problem, or a medical problem related to some of these sleep problems, you have to use some of your, I guess the common sense approach to it and say, "There's no free lunch ever."
Right. Right. Although there's a lot that we know now about when to maybe do things that can use some just natural advantages that maybe your body or our understanding about things have changed over time. So I would say that's the more exciting part for me. Like there's ways to engage in, metabolic burn. There's ways to engage in the types of foods that you eat
Mhm.
that have a huge impact. And even, we've talked about with breath work, like there's ways that you can engage in essentially muscle training for your respiratory system.
Right. And there's more than one answer. So if you feel like you're getting conflicting information or you're getting like which is the right one, it's because there's more than one answer that works the
Mhm.
best
Right.
for everybody. So don't feel like you have to go one school of thought and not the other. There are many people that actually use medicines like tirzepatide for their sleep apnea and their weight and are also still looking at bariatric surgery and vice versa.
Yep.
And there's also a lot of people that have kind of a goal in mind that they're gonna stay
Hmm.
on a medication for a certain amount of time while they're working on their behavioral habits. And I'd like to see those trials go out, but guess what? The drug companies don't want to do those because they want you to be on this medicine indefinitely. And sadly, it's going to make them a lot of money and make us still in that sick variety. So,
Sure.
just be really careful. Just like what I've told people with sleep medicines is there's not a medicine that's going to give you better quality sleep and more sleep. You have to do some of the work that's on it.
Mhm.
So, the other thing that I will point out, and again, this is what I wish they would tell us on the physician prescribing things before they put it on the Associated Press,
Uh-huh.
is just because it's FDA approved does not mean your insurance covers it. And
Right.
so insured, business type of models, and also on major commercial plans, it is not going to be on their formulary for sleep apnea immediately. So I don't even know how many prescriptions in the last few weeks that I've sent for Zepbound. And even before this whole thing, they got approved for sleep apnea just because of their weight or their diabetes. Just remember is we don't, as physicians, just because it's FDA approved, get to say that your insurance is going to cover it, because it's probably not. It is a quite expensive medication that, unless that insurance company feels the benefits versus the drawback of the cost are going to be warranted, they will not cover it.
Hmm. Yep. Absolutely.
So don't call in yet. Okay. We give it like 6 months or so. But it is an exciting time. So I hope that helps in case everybody had any questions about it or didn't know. But there is a medicine that's approved for sleep apnea. It's not the one I thought was going to be approved first. There's another combination medicine that's a mixture of a atomoxetine and an oxybutynin that will also be approved soon for sleep apnea treatment. And it has nothing to do with weight loss. In my opinion, based on the studies so far, I have a feeling it decreases the apnea index because it decreases the deep sleep. But I am told that there's a different mechanism by the pharmaceutical industry itself and people that are paid by the pharmaceutical industry to talk about it. And I have a couple patients in the clinical trials. And so we'll see, when it gets approved. But that's what I thought was going to be the first pill that was approved for sleep apnea.
Oh,
And it still may be, considering that while Zepbound could be actually a pill, in this country, the FDA approved it as an injectable medicine.
right.
So go
Yep.
figure.
Yep. All right. And as always, all of our, sleep takeout listeners, like this is just kind of, general kind of information, helpful information. We always encourage you to reach out to your individual healthcare providers to get individualized information for you personally. So
This
this,
is not medical advice. You don't have a doctor-patient relationship with us. And if you do, talk to us in our regular lives. But we
exactly.
really enjoy bringing this information to you. And we hope that you stay tuned for the next episode.
All right. Until next time, Sleep Nation.
All right. Bye.
Bye.